The chair lays out House Bill 3902 and offers a committee substitute and recognizes Representative Rose to explain the bill.
Thank you, Madam Chair. Members, as Madam Chair stated, there's a substitute, and the substitute incorporates feedback from Health and Human Services Commission to address operational concerns and reduce the cost. We have a resource here, well, that's another thing. Anyway, nursing facilities are required to go through a very erroneous process in order to complete the change of ownership process, also known as CHOW. During the CHOW process, nursing facilities must continue to care for patients and fund that care without Medicaid reimbursement. However, a process that previously took about 6 weeks can now take up to 9 months. This prolonged lack of reimbursement strains nursing facilities and can jeopardize the care being provided to residents. The committee substitute addresses this issue by ensuring uninterrupted Medicaid payments if the new provider, 1, meets the bill requirements and other requirements currently in statute, such as licensing. 2, they're enrolled in Medicaid, and if required, Medicare. And the third one is they assume the prior provider's contract. They also enter a successor liability agreement and meet the requirements determined by the commission. The successor of liability agreement ensures integrity in the child process and that nursing facilities don't manipulate the process to the detriment of their residents and Medicaid program. It would ensure any liabilities of the previous owner are transferred to the new owner during the child. The bill will make a child process more efficient while also creating accountability for nursing facilities. And with that, Madam Chair, I reserve the right to close. And I would answer any questions you may have, but I do have some expert witnesses here who are well-versed in this complex process who could answer any of your questions.
Members, any questions? Okay, we'll proceed to testimony. Chair calls Daryl Zurovec.
Yes, thank you.
Daryl Zurovec with Texas Healthcare Association, Touchstone Hearing and for the bill, is that correct?
Yes.
Okay, thank you. You may proceed.
Thank you, Madam Chair. Thank you, Representative Rose, for introducing this bill. This is a very important, my name is Daryl Zurovec. I'm the General Counsel for Touchstone Communities, and I'm also on the board of the Texas Healthcare Association. And I've been working on changes of ownership since before I was a lawyer. One of my first projects as a law clerk was to work on a change of ownership application. So I've seen this process since the early 90s, and it is worse now than it has ever been. HHSC has created a process that is almost impossible to work through. What used to take 6 weeks now takes 6 to 9 months, and if everything doesn't go perfectly, it can take over a year. During that time, the provider's not paid, providing care, but they're not being paid. And there's lots of reasons that could go into that I could go chapter and verse for a long time on that, but that's for another day. This bill, the original intent of this bill was to provide a trade-off. So in Texas, when you're a Medicaid provider, you're responsible for the time period when you operated the community, and you're not responsible for liabilities of a previous operator. That makes sense, right? But on the flip side, we've got this problem with a lack of payment while the change of ownership process is pending. And so the original intent of the bill was to provide a trade-off. Providers would accept liability for a previous operator's time period, and we would deal with that contractually with the previous operator. But on the flip side, HHSC would create a system that allows us to continue to bill while the change of ownership is pending. So as long as that's what the committee substitute does and what this bill continues to do, we'd be in favor of it. And I'd be happy to take any questions.
Thank you. Members, are there any questions? Okay, thank you. Chair calls Travis Clardy with Texas Healthcare Association, and you are for the bill. Is that correct?
That is correct, Madam Chairman.
Thank you.
All right, thank you. It probably wasn't worth all the wait and the hassle, but I did want to speak on this. Our board met last week at the Texas Healthcare Association, and the frustrating thing about this issue has been We're not asking the commission to do anything other than what they have done historically for years and years and years. And so COVID, I know, has upset a lot of processes. I think we're still trying to come out of that. There's a work group that's formed on this. But I want to thank Representative Rose and her staff for the hard work they've put on this bill to push this forward. But the delay used to take 30, 45, 60 days to process the CHOW, the change of ownership. Last week, we heard a story. It was 16 months from application to processing. And in that time period, under current law, you do not get compensated for the services that you provide. So simply, we're looking for the successful liability portion of the bill. I know nobody on this panel has had any problems getting exactly what they wanted out of Ledge Council. I'm sure nobody's experienced that. And so this would be one of those things, and I appreciate Representative Rose again working on that. There's some things that still need to be tweaked, but the spirit of the bill, as Mr. Zerbeck talked about, we strongly support. This is a needed change, and what we've been told from the commission is they need legislative instruction. And I'd much rather for them to take their instruction from the elected representatives of the people than making decisions as a bureaucracy, as an organization that aren't as accountable. So this is a time your constituents, our members, need your help to solve this problem, get this thing back on the streamline. We're asking them to do nothing other than what they've always been able to do historically. Going forward, in lieu while they sort that out, the successful liability portion where we can get paid pending would help. On the other side of this equation, one of the MCOs was at our board meeting and said that they have had a problem when these applications go more than a year, that it's difficult for them internally in accounting to make the payments to go back and reopen a prior year to get that out. So it's messing up everybody in the process, and you'll hear this complaint from other health folks in the healthcare space, not just nursing homes, long-term care. So with that, I would strongly urge you to support Representative Rose's bill, and thank you for the opportunity to testify. And any questions?
Members, any questions? Thank you.
Thank
We-
you.